Now the other thing that we did for her is we augmented her bridge. And so you can see over here there's a sort of a gray bit of tissue here. This is actually Gore-tex. And the Gore-tex is inserted and lays right on top of the nasal bridge bones and cartilages. And that augments this part of the bridge. The reason we use Gore-tex here is because you probably need several millimeters of augmentation of the bridge, and usually the septal cartilage is just not that thick. So I think in most cases, to get a substantial augmentation, you usually have to use a synthetic material. I like to use Gore-tex because it's soft and I can carve it in a very custom way. It also has a very, very low rate of complications, so I think it's a good material to use for this purpose. So in addition to the Gore-tex graft that you can see that I've applied to the bridge, I'm also showing the cap and shield graft that I applied before on side view. And you can kind of get the sense for how these cartilages project her existing cartilages further forward and therefore project her tip further forward and give it more definition. So this is before, and this is after with the tip cartilages in place and the Gore-tex graft on the bridge. And then I'll just show you her actual photos so you can see that her tip has been projected further forward, and I've done a very subtle augmentation of her nasal bridge. You'll see on her base view that in addition to projecting the tip in a forward direction, I've also narrowed her nostrils. So what I've done is I've made some small incisions just at the base or the nasal sill, so just the floor of the nostril, right around the corner. I've removed some of the skin and then tucked it inwards. So you notice that on this view now, her nostrils are much narrower. It's also changed the contour of the sidewalls a little bit, and so these are a little straighter now than they were before. So they were slightly flared, and now they're a little straighter. So overall, again, this is a before and after of augmentation of the nasal bridge, the nasal tip, and reduction of the alar base. And these are her 3/4 views.